Your body speaks to you in whispers before it starts to scream. But are you listening to what it's trying to tell you? Sometimes the most important health signals come from the places we least expect, like our feet. Millions of people worldwide suffer from undiagnosed thyroid conditions, spending years searching for answers while overlooking crucial clues that have been right beneath them all along. I'm about to share 10 critical warning signs that your feet might be giving you about your thyroid health. Signs that many doctors miss or dismiss. These signals change lives of many clients, and recognizing them could change yours too. Before we dive into these warning signs, let's understand why this connection matters. Your thyroid, this butterfly-shaped gland in your neck, produces hormones that regulate nearly every cell, tissue, and organ in the body. When your thyroid isn't functioning properly, whether it's underactive hypothyroidism or overactive hyperthyroidism, the effects cascade throughout the entire system. Your extremities, particularly your feet, are often the first to show signs of thyroid dysfunction and the last to recover when treatment begins. This makes invaluable yet often overlooked indicators of thyroid health. And that brings me to a story of how a routine pedicure led to a life-changing discovery. My mom was wrapped in a plush white bathrobe at an upscale spa, eagerly awaiting a deluxe pedicure. The basin was filling with warm, fragrant water as the pedicurist examined her feet with professional scrutiny. Then she said something that would echo in my mom's mind for years to come. She said it loudly enough that nearby patrons turned to look. Embarrassed by the sudden attention, my mom whispered back. Her response was simple but profound. You should see your doctor about your feet. This woman, a pedicurist, not a doctor, could see plain as day the signs of a serious health condition just by looking at my mom's feet. Yet it would take 10 more years before she finally received the formal diagnosis, severe hypothyroidism. This experience taught me that our bodies often communicate in subtle ways, and sometimes the messages come from those unexpected places, like our feet. Now I want to share these signals with you. The 10 warning signs. Signs number 1, dry, flaky, cracked feet with calluses. The first and perhaps most common sign is dry, flaky, cracked feet with calluses. This isn't just ordinary dryness that a bit of moisturizer can fix. Research confirms the strong connection between skin conditions and thyroid function. A 2012 study examining skin manifestations of hypothyroidism found that over 65% of diagnosed patients presented with dry, coarse skin. Another study that same year reported that 100% of hypothyroid subjects exhibited coarse, rough, dry skin. Particularly telling is a condition called palmoplantar keratoderma found in 33% of hypothyroid patients, which causes marked thickening of the skin on the soles of the feet and palms of the hands. Interestingly, hyperthyroidism due to Graves' disease may also present with thickened dermis, demonstrating how both under and overactive thyroid conditions can sometimes manifest with similar symptoms. Many patients hear dismissive responses from healthcare providers. That's not your thyroid, you're just getting older, it's all in your head. These dismissals can be frustrated when you intuitively sense a connection between your symptoms and thyroid function. If you've tried every foot cream on the market without improvement, your feet might be trying to tell you something more serious. Number 2, persistent itchy feet. Pruritus, the medical term for itchy skin, can occur in both hypo and hyperthyroidism. While the itchiness may affect various body parts, including legs, scalp, and even genitalia, feet are commonly affected. In hypothyroidism, the extreme dryness of the skin likely contributes to the itchiness. Research suggests that chronic pruritus and even chronic hives may be associated with thyroid autoimmunity, including Hashimoto's and Graves'. This connection highlights the complex relationship between the immune system and thyroid function. The autoimmune connection is particularly significant because developing one autoimmune condition increases vulnerability to others. The Cleveland Clinic identifies several autoimmune conditions associated with chronic pruritus, including Sjogren's syndrome, lichen planus, and psoriasis, conditions that may coexist with thyroid disorders. If you find yourself constantly scratching your feet and typical remedies don't provide lasting relief, consider this a potential thyroid warning sign worth investigating. Chronically cold feet. We're not talking about pre-wedding jitters here. This is about feet that remain cold even in warm environments. Dr. Broda Barnes, a pioneer in thyroid research, observed that reduced thyroid function significantly impacts circulation. He noted that in advanced hypothyroidism, the skin might receive as little as 1/5 of its normal blood supply. Our extremities, particularly the feet, become especially vulnerable to poor circulation, especially during colder seasons. The body makes metabolic adjustments to maintain core temperature, sometimes at the expense of peripheral circulation. As Dr. Barnes explained, in a cold environment when body heat must be conserved, sympathetic impulses constrict the cutaneous vessels and blood flow through the skin is conspicuously reduced in order to prevent body temperature from falling. This understanding led Dr. Barnes to develop a diagnostic approach using basal body temperature. By measuring axillary or underarm temperature before arising in the morning, patterns emerge. Consistent below normal temperatures suggest hypothyroidism, while above normal temperatures may indicate hyperthyroidism. If your feet remain cold despite warm socks and adequate room temperature, your thyroid might be trying to send you a message. Sign number 4, swollen feet and ankles. The fourth sign is swollen feet and ankles. When patients present with swelling in their legs and feet, healthcare providers typically consider heart disease, kidney dysfunction, diabetes, or skin infections as potential causes. However, hypothyroidism should always be on the differential diagnosis list, as edema or swelling is a classic symptom that can affect the entire body. A compelling case from 2013 involving a 21-year-old patient who presented with generalized swelling, including pitted edema in both legs and feet. Pitted edema, where pressing on the swollen area leaves an indentation that remains after pressure is released, differs from non-pitting edema and can be a significant clinical sign. This patient's edema resolved with thyroid medication. According to Dr. Necki, peripheral edema occurs in approximately 55% of hypothyroidism patients, with periorbital edema, swelling around the eye orbits, affects about 22% of patients. If you notice persistent swelling in your feet and ankles that doesn't improve with elevation or isn't explained by other obvious causes, consider asking your healthcare provider about thyroid testing. Sign number 5, foot pain and cramping. While muscle, joint, and nerve pains aren't typically emphasized as primary symptoms of hypothyroidism, clinical experience suggests they should be. Full thyroid testing should be considered for anyone presenting with chronic pain or fibromyalgia-like symptoms. The frequency of plantar fasciitis, characterized by pain along the bottom of the foot, especially the heel, that intensifies when stepping out of bed in the morning, among thyroid patients suggests a meaningful connection. In autoimmune thyroid conditions like Hashimoto's and Graves', the immune system can attack joints and muscles, frequently affecting the feet and ankles. Thyroid patients also face increased vulnerability to tarsal tunnel syndrome, similar to carpal, but affecting the feet, gout, burning feet from painful neuropathy, and plantar fasciitis. These connections make foot pain a potential significant indicator of thyroid dysfunction. If you experience unexplained foot pain, particularly first thing in the morning, or pain that doesn't respond to typical treatments, consider discussing thyroid testing with your healthcare provider. Sign number 6, tingling, numbness, and pins and needles sensation. Paresthesia, the medical term for these abnormal sensations, can manifest in hypothyroidism due to specific physiological changes. Researchers explain that without sufficient thyroid hormone, the axonal myelin sheath, the insulating layer around your nerves, begins to degenerate, and the regeneration of damaged nerves slows significantly. These sensations aren't exclusive to thyroid conditions. Autoimmune diseases, including rheumatoid arthritis, lupus, and type 1 diabetes, can all present with paresthesia. Many patients with Hashimoto's or Graves' have multiple autoimmune conditions, making these symptoms particularly complex to diagnose and treat. If you experience persistent tingling or numbness in your feet that isn't explained by sitting positions or other obvious causes, this could be your thyroid sending you an important message. Sign number 7, increased susceptibility to foot infections. Both hypo and hyperthyroidism can increase vulnerability to infections of the feet, hands, fingernails, and toenails. Common infections include onychomycosis, fungal nail infections, and athlete's foot. The altered immune function associated with thyroid disorders may contribute to this increased vulnerability. Thyroid hormones play a crucial role in immune system function. When thyroid levels are imbalanced, the body's natural defense mechanisms may be compromised, making you more susceptible to infections. If you find yourself battling recurring foot infections despite proper hygiene and treatment, consider asking your healthcare provider about possible thyroid involvement. Sign number 8, unusually smelly feet. The 8th, and perhaps the most embarrassing, is unusually smelly feet. Excessive sweating, a classic symptom of hyperthyroidism, can affect the feet and create an environment where bacteria thrive, resulting in unpleasant odors. While hypothyroidism typically results in reduced sweating, the situation becomes more complex with Hashimoto's thyroiditis. In Hashimoto's, patients may experience symptoms of both hypo and hyperthyroidism simultaneously or alternately. As antibodies attack and destroy thyroid cells, stored supplies of thyroid hormone release into the bloodstream. These bursts of thyroid hormones can temporarily create hyperthyroid symptoms, including increased sweating, even in a person who is predominantly hypothyroid. Sweat itself doesn't smell, but it creates a perfect breeding ground for bacteria, which produce the odor we associate with smelly feet. If you notice unusual foot odor that doesn't respond to typical remedies, particularly if it coincides with other symptoms we've discussed, consider discussing thyroid testing with your healthcare provider. Sign number 9, yellow discoloration of foot soles. This isn't jaundice or a stain from your shoes, it's a biochemical signal. Thyroid hormone plays a crucial role in converting beta-carotene, the compound that gives carrots their orange color, to vitamin A. In hypothyroidism, this conversion process becomes impaired, leading to a beta-carotene buildup. This excess beta-carotene gets stored in the outer layer of the skin, particularly in the palms of the hands and soles of the feet, causing a distinctive yellowish discoloration. Unlike jaundice, which affects the whites of the eyes as well as the skin, this yellowing is typically limited to specific areas like the feet and hands. With proper thyroid treatment, this discoloration typically resolves as the body regains its ability to properly convert beta-carotene. Sign number 10, toenail alterations. Both excessive and insufficient thyroid hormone can result in abnormalities of the nails, affecting both fingernails and toenails. In hypothyroidism, nail changes typically include slowed nail growth. You might notice you're trimming your toenails less frequently than before. Thick, dry, cracked, and brittle nails are common, often with a yellowish discoloration. The cuticles may become dry and prone to splitting or peeling. Longitudinal ridges, lines running from the base to the tip of the nail, often appear. These ridges can be a sign of various health conditions, but when combined with other symptoms, they may point to thyroid dysfunction. Ankylosis, separation of the nail from the nail bed, can occur, creating a space under the nail that can become infected. Some hypothyroid patients develop conychia, or spoon-shaped nails, where the nail becomes concave with raised edges. Conversely, hyperthyroidism often presents with accelerated nail growth. You might notice needing to trim your nails more frequently. Pitting and discoloration are common, as are absent lunae, those white half moons at the base of your nails may disappear. A specific type of oncolysis, called plumber's nail, where the nail separates from the nail bed, starting at the tip and extending backward, is particularly associated with hyperthyroidism. These nail changes provide visible evidence of thyroid dysfunction that careful observers, including yourself, might notice before other symptoms become apparent. If you experience any of these foot-related symptoms and suspect thyroid involvement, it's time to advocate for your health. First, trust your instincts. You know your body better than anyone else. If you sense a connection between your symptoms and thyroid function, pursue appropriate testing. Second, seek comprehensive thyroid testing. Beyond the standard TSH test, consider requesting free T3, free T4, reverse T3, and thyroid antibody tests for a more complete picture of your thyroid function. Third, be persistent. If your initial healthcare provider dismisses your concerns, seek a second or third, even 10th opinions until you find someone who listens and understands the complex manifestation of thyroid disorders. Fourth, consider the possibility of multiple conditions. The presence of one autoimmune condition increases the likelihood of others, so comprehensive evaluation may be necessary. Finally, remember that proper diagnosis leads to appropriate treatment. Many of these foot-related symptoms improve significantly with proper thyroid management. The journey to diagnosis may be challenging, but the improvement of quality of life with proper treatment makes it worthwhile. Our feet seem far removed from the butterfly-shaped gland in our necks, but they can provide valuable insights into our thyroid health. From dry, cracked heels to nail changes, from persistent coldness to unexplained pain, your feet might be trying to tell you something important about your thyroid function. By paying attention to these often overlooked signals, you may discover important clues that lead to proper diagnosis and treatment of thyroid conditions. I encourage you to examine your feet today. If you recognize any of these signs, especially in combination with other thyroid symptoms, speak to your healthcare provider about appropriate testing. Remember, thyroid conditions are highly treatable, but they must first be properly diagnosed. Your feet might just hold the key to unlocking better health.